A very warm welcome. You're watching Times Now with me, Priya Bahel. Now we speak amidst reports of an outbreak in China, where 3 cases of HMPV or a human metapneumovirus have now been detected in India as well. It is a respiratory illness which shows flu-like symptoms. Its outbreak in China has raised health concerns globally. As per reports, it affects individuals across all age groups, from young children to the elderly, and especially those with a compromised immune system being the most vulnerable. The Indian Council of Medical Research has confirmed first 2 cases in India from Karnataka's Bengaluru. First case, an 8-month-old male infant is recovering in hospital, while in the second case, a 3-month-old female infant has been discharged. Now, both cases had a history of bronchopneumonia. The infants and their family had no history of recent international travel. These cases were discovered through routine surveillance. Following this, Karnataka's health minister has chaired an emergency meeting, and Dinesh Gundu Rao has assured everyone that there is no reason to panic. It is a common virus. China variant could be a new strain. He even said that there is a need to check the strain in China that is causing the outbreak. But here it is important to take necessary precautions. Meanwhile, third case has been detected from Gujarat. A 2-month-old infant tested positive for HMPV.
It is found in 2 children. Immediately after seeing this, I talked to Mr. Dinesh Gundu Rao, who is in charge of the health department, and he responded quickly, and he took up a meeting with the department, and whatever decision he takes, the government will implement it, and the government will take all precautionary measures to implement and to prevent the disease.
I don't think we should be pressing the panic button, because HMPV is not a new virus, it is an existing virus. And the statement, the way report has come out that this is the first case of HMPV in India, which is not true, because HMPV is an existing virus, and certain percentage of people do get affected by this virus, and it is not something new. And the baby, the child that has got affected, has got no travel history, and they're all local people. They're not coming from China or Malaysia or some other country. So I do not think there's any connection to that. China's outbreak is, they are saying, is a new variant of HMPV. So that is what they are saying. We don't have the full details.
So before we get in experts to answer the questions that are now arising in everybody's minds, because the memories of a coronavirus are very, very fresh even now, let's tell you a little bit about the virus that we are talking about, the HMPV virus. It is a human metapneumovirus, a common respiratory virus. It's not a newly discovered virus. It was first found in 2001. In fact, some reports have even suggested that it's been in circulation since 1958. It causes common cold-like symptoms, can cause respiratory diseases, and spreads in winter and early spring. Health Ministry is saying that HMPV is already in circulation in India. There has been no unusual surge that has been seen so far, and therefore there is absolutely no need to panic. There is also reaction that came from Delhi's former Chief Minister Arvind Kejriwal, where he said that this calls for immediate attention from the centre. The centre, on the other hand, says that they reassert that there is no need to panic, as HMPV is already in circulation globally. The centre has clarified that the government is well equipped to handle potential rise in respiratory illnesses, and that there is no unusual surge in influenza-like illness in India. They have also said that centre is monitoring through all available surveillance channels the status of HMPV spread in India, and they will be tracking trends in HMPV circulation throughout the year as well, and not just now when reports of a surge are emerging from China. To answer all the questions that might be emerging in your minds, we are now joined by Dr. Neetu Jain, who's a senior consultant of pulmonology in PSRI Hospital in New Delhi. Thank you, ma'am, for joining us. Let's first talk about these 3 cases that have been found. Would you see it as just a coincidence that all 3 cases have been found in very, very young children?
See, this virus has always been very prevalent in young children, less than 5 years of age. So it is not unusual to find these cases in young children. However, finding these cases now, because we are actually actively looking for virus, is a coincidence. It's not like that this virus was not prevalent before. Actually, 5 to 10% of winter flu cases are because of this virus previously also. So finding in young children is a norm. But finding it during winter season is not unusual.
Okay, so when they say that these kids were diagnosed with HMPV, what exactly is the test that they undergo to do that?
RT-PCR is done for HMPV like it is done for other viral illnesses like COVID or influenza. All of them are discovered on RT-PCR through nasal swab or a throat swab.
And when should one consider going for these tests?
See, at this point in time, we are actively doing surveillance. One will go for this test under surveillance. Otherwise, if a young children, an older adult more than 65, or an immunocompromised person develops severe respiratory illness, then such a person should undergo test for HMPV, considering that this can be because of this virus. Though no specific treatment is available for this virus, even if it comes positive, then we have to actually do the supportive care only.
Okay, and what would this supportive care entail, and can it be done at home? Is it similar to what was happening during COVID?
See, for mild illnesses like cold, cough, fever, mild sore throat, one can be treated at home. But if you develop shortness of breath, cough with expectoration, and feel acutely ill, then it is better to hospitalize, because if it is pneumonia, then hospitalization is best for monitoring as well as supportive care like oxygen or maybe non-invasive ventilator or ventilator, maybe, because it is usually the virus present as mild illness.
Okay, now we heard the ministers from Karnataka also talking about some new variant of HMPV. So let's just explore a bit more on that. We're also inviting queries from our viewers who would be watching us. If there is anything that they want answered from our expert guest on the show, they can please call us on the numbers that are running on the screens right now. But Dr. Neetu Jain, there are these this virus is old, is what everybody is saying, but what about this new variant that is being spoken about? Is there anything at all that is a matter of concern, although from state to center everybody is saying that everything is under control?
You see that we don't have much information on the variant, but viruses are always mutating. So getting a new variant of virus is not unusual. Like flu virus, every year you get a new flu virus for which you vaccinate again, because viruses are always mutating. So it is not unusual getting a new variant. How difficult this variant is, how much it is likely to spread, how severe illness it will cause, will only be clear after we have more information from China. But in India, the 3 cases which have been discovered, they have been from people who have never traveled anywhere. So we are not expecting that these HMPV cases are because of any new variant of HMPV. It must be the usual virus which is circulating in winter month as usual.
Okay, and given that it's been around for decades is what is being said, have there been any instances in the past that could raise any sort of extra concern, probably, especially in the vulnerable groups of very young children and immunocompromised individuals?
So it has been studied in the past. At least I can recall one study of 2001 in which they have studied about 100 odd cases. So in immunocompromised patient, it can cause bronchitis, it can cause pneumonia-like illness, which can be severe. So severity of illness is concerned definitely in immunocompromised patient, especially those who have undergone organ transplant, or those who are on chemotherapy or some drugs because of rheumatic diseases which compromise immunity. In such people, it can cause severe pneumonia. Severity of illness is definitely more in immunocompromised patients, so it is of concern definitely.
So far, incidents have been few and far between. But when would you think would be a time when, at an institutional level, probably the people might need to take precautions?
I think it is too early to say that, that we have to take precaution at an institutional level unless the situation become clear from China's part, and also if we will see travelers pneumonia in people who have traveled to China or Malaysia or region which are affected by HMPV. It is too early to say that we need some institutional precautions.
Okay.
However, usual precautions like washing hands, using masks, staying away from people who have cough and cold are always better for any respiratory illnesses.
And is there anything in terms of precaution that people who have to travel to these countries for work or for whatever other reasons can take, apart from the usual caution that you've just prescribed?
I think the usual caution is what they will require most stringently, though. I mean, if you are meeting people, then be sure that those people are not suffering from any acute illness. If you shake hand with somebody, then wash your hand at least. Use mask. The usual precautions are what are required. There is no specific vaccine for this virus, so we cannot say that you can take this vaccine before visiting a country like China. Other than that, take care of your health, drink enough water. Do not use an unnecessary antibiotic on one sneeze or a little bit of sore throat. That would be my advice to such people.
All right. Thank you, Dr. Neetu Jain, for joining us with those insights. So the big story here, you can just be cautious. You have no need to panic whatsoever. The cases are few and far between. There is nothing new about this virus. China may be seeing a surge depending on the reports that have come out from there. But as far as India is concerned, there is no such situation right now. Both center and states where these cases have been reported has said that they are very well prepared to take action depending on how the situation develops. Thank you for joining us, ma'am. We take a very quick break.